Hi, I am Dr. Amitabh Banerjee, an epidemiologist and author of COVID-19 Pandemic, A Third Eye. Today, I'll be discussing chapter 19 of this book. Title is Mysterious Fever, a Bigger Challenge Than COVID. A large number of cases were reported among children in Firozabad, a city with a population of over 6 lakh near Agra, and known for its making industry. This column was written when there were large number of cases and whole villages were falling sick. Some children were dying. Sometime in September, October, I think 2021, when they were worried about the pediatric wave, coming imminent pediatric wave, and a large number of pediatric beds and ICUs were kept ready. So the idea of this column was that we have much bigger public health problems on our hands, and we are just waiting for an imaginary wave which never came ultimately. And where actual children were dying, people were getting sick. The I have got the data, number of samples taken, any diagnosis which were established. So this is the idea that public health, which actually should be driven by local priorities, we are just being swayed by what messages we are getting from the northern hemisphere rather than our own disease priority. So this was somewhere in post-monsoon, 2021. 11 districts in Uttar Pradesh were in the grip of suspected dengue and other fevers. The other suspected causes of fevers in these districts were scrub typhus, leptospirosis, Japanese encephalitis, which is caused by a virus, and other viral encephalitis. Even malaria or typhoid, endemic in large parts of India, could have added to the numbers. I mean, these are diseases which could be identified if properly investigated, but no, everybody was waiting for pediatric. Firozabad in Uttar Pradesh is the center of this outbreak, was the center of this outbreak of mysterious fever among children. It is a city with a population of over 6 lakhs near Agra, famous for its glass making industry. The population density is over 1,000 per kilometer, more than twice the national population density. So any communicable disease can spread like wildfire in such a dense population. The city is on the national highway, which makes it an important stopover for passing transport vehicles. The district includes a large rural belt with to and fro urban-rural movement of people in search of occupation. These create an ideal environment for spread of febrile illnesses from this epicenter to other parts of the state. The spate of febrile illnesses hit hard in the region. There was confusion and chaos. There were reports of people fleeing from entire villages as many, mostly children and young people, died from mysterious fever. Here, children were actually dying this time. And we were waiting for an imaginary pediatric wave of COVID, which had never affected children. The data was available since the start of the pandemic. Strange. According to media reports, thousands of people in Firozabad district were bedridden with fever at home and hospital. In a short period, there were 71 reported deaths, of which tragically 52 were children. Out of a meager 185 samples tested, 73 were positive for dengue, 28 for scrub typhus, and 1 for Japanese encephalitis. Just note the number of samples. 185 samples were tested where hundreds of people were affected and 50 plus children died. In the 18th century, when being told that our French subjects had no bread, Marie Antoinette, the Queen of France, supposedly sniffed. Quill manget de la brioche. Let them eat cake. With that callous remark, the queen became a hated symbol of the decadent monarchy, oblivious to the poor conditions in which many of her subjects lived while she lived decadently. We are experiencing the same ethos among the health policy makers. Here we were with one of the largest states in the country in a grip of mysterious fever, which was killing mostly children and young people, and all our resources were deployed in mass vaccination for COVID-19, which rarely kills children and young people, and quixotically preparing for the pediatric third wave. To add to the irony, vaccine trials for COVID-19 was being conducted among children with unholy haste. Schools continued to remain closed, ostensibly to protect children from a lethal virus, that is the COVID virus. The panic among parents was sustained so that rush for vaccine for the children before they go back to school. UP health officials confirmed this thought process in a statement that with increasing cases of this mysterious disease, the situation was fast turning COVID-like. I just fail to understand what a comparison. Children never got affected with COVID. Children never. And what was COVID like? What an amateurish comparison. With so many deaths among children and young people from this mysterious fever, only 185 samples had been tested after a month into this outbreak to identify the mysterious fever as compared to lakhs of RT-PCR tests to detect COVID-19, which were done every day on asymptomatic people, young and old. Lakhs of RT-PCR was being done at the same time for COVID, which hardly affected children. Post monsoons, dengue is a major public health problem in our country year after year. It is a lethal cause of hospitalization and death among children and young people. Death rate can vary from 2 to 20%, depending on the severity and access to early diagnosis and management. The dreaded dengue hemorrhagic fever with severe fall in platelets and bleeding can be fatal, which actually in these remote parts, the main problem of dengue is if there is acute fall of platelet, there can be hemorrhage, bleeding, capillary leak, and if you have good health services, they can be prevented. The deaths and complications can be prevented. But as you can imagine, hardly this mysterious fever, people are left at the mercy in these villages of Uttar Pradesh and other parts of the country where the health facilities are not there. Even now, in Pune and Bangalore, where I am staying in Pune, there is severe and large cases of fever, and I have also had a very bad 10 days with severe joint pains, fever. All my joints are painful, and knee is painful, and I am also been suffering for the past 10 days. That's why, and I can imagine diagnosis also is difficult, which is a common. Dengue is rampant at present in the place I am staying. Zika virus and chikungunya also simultaneously running rampant, and very difficult to diagnose across these three viruses. All are flaviviruses. And platelet count also, one of my near family members had an acute fall of platelet count, and luckily she had recovered. So I can imagine plight of people in the remote villages. And I tried to look up the data on dengue, which is running rampant as on today. It is the data is more than 3 months old in the public domain. More than 3 months old. In latest data we don't have on dengue. Whereas in COVID, you remember every 24 hours the data was being updated. So, and still we are now also getting anxious about a future pandemic, which will be many more times more severe than the COVID. As it is, we are having many more times severe disease, neglected tropical diseases like Japanese encephalitis. Children die every year. in parts of Uttar Pradesh like Gorakhpur and other places. Scrub typhus, even Chandipura virus is running nowadays rampant. So many things we are already having on our hands, and we are waiting for imaginary future pandemics. The dengue is rampant and very difficult to eradicate because the vector Aedes is very sturdy. Virus persists in it, even intergenerational transovariant. The dengue virus is transmitted by the bite of Aedes mosquitoes, which thrive in artificial water collections. The mosquito, also known as the tiger mosquito, is a day biter. This is the another challenge. The day biter, they are, and you can't tell the mosquito to keep the 6 feet distance in which they did COVID appropriate behavior. You have to go out. There are 4 serotypes of the virus, and previous infection with one serotype does not protect against subsequent infections by a different serotype. In fact, this sequential infection with different serotypes makes a person more vulnerable to the dreaded dengue hemorrhagic fever. So dengue is a problematic infection. The second suspect for this mysterious illness was scrub typhus, with 28 confirmed cases out of 185 samples taken. This is caused by rickettsia, a small bacterium named after Howard Ricketts, the American pathologist who died of it after discovering it. Scrub typhus is transmitted by bite of mites which thrive in grassy soils. Post monsoons, these grassy mite islands expand. The cycle of transmission continues in nature between mites and rodents. Children playing on grassy terrain and campers are accidental victims. Scrub typhus is treated with antibiotics like tetracyclines. When treated early, the mortality is 1.6%. And in COVID, even without treatment, mortality is 0.1% less than that. And in children, negligible. In untreated cases, the mortality can be 30 to 35% scrub typhus. And you can imagine untreated means many times it is not diagnosed. Children die of mysterious fever. Japanese encephalitis is a viral infection which can affect the central nervous system. It is transmitted by Culex mosquitoes which breed in the rice fields. The natural cycle is between mosquitoes and pigs or other animals like cattle and in birds and poultry. You see all these we are having. Now we are worried about bird flu and this and that. And here we have got Japanese encephalitis year after year, which are amplifying in bird and in cattle and in pigs and all. And our children are dying, nobody is bothered. And here we are worried of one child detected with bird flu in India, and there's a huge panic, and there are conferences on bird flu and other things. I mean, what is the present problem? Nobody is bothered. The animal and bird hosts do not themselves suffer from the illness, except horses, but set as amplifier hosts. That is, the virus multiplies in them. Mostly the infection do not cause symptoms, but can be fatal in children and young adults with a case fatality rate of 20 to 40%. You see, we are worried of imaginary pandemics, which we are having real pandemics, which are not recorded, not tested, not diagnosed. Neurological deficit in survivors are common. Here we are worried of long COVID, long. Here we are having everything is long Japanese encephalitis, long so many other sequelae of so many other diseases. Vaccine for Japanese encephalitis available but not promoted with the same gusto as for COVID-19. Poor people, poor country, neglected tropical diseases. Other diseases such as malaria and typhoid are other unfinished agenda in our country. Malaria, while treatable, can cause rapid deterioration in some cases where fatality can reach 20% even with treatment, particularly the falciparum malaria. Typhoid has a fatality rate between 1 to 4% with treatment, imagine. While without treatment, the fatality rate can be as high as 10 to 30% typhoid are neglected. Children and young adults between 5 years to 19 years have the highest incidence, and we have got a vaccine for typhoid. Nobody is talking about it. Leptospirosis is also on the suspected list of probable cause of fevers. It is again an infection which spreads from wastewater contaminated by urine of animals which carry the bacterial spirochetes. While it can be treated with antibiotics like penicillin, death rate can vary from 5% to 30%, depending on diagnosis and treatment facilities. It is common after monsoon due to waterlogging, though which people may wade through which waterlogging, through the water, when people wade through this water, the organism may enter through skin abrasions or cuts. Untreated COVID-19 has a mortality rate of 0.3% across all age groups at the world level and less than 0.1% in India. You see, COVID-19, even without any, they're mostly self-limiting. And here we have got other conditions which with treatment are having high mortality, many times, 10 times higher mortality than COVID. With each a low with such low death rate, even in the natural course of the infection, it is quite difficult to evaluate impact of any therapeutic or preventive intervention. The science and art of public health demands that scarce resources should be allocated to diseases with high public health burden. This is determined by the death rates and potential years of life lost. From above comparative data, it would be evident that all the potential causes of mysterious fever which created havoc in districts of Uttar Pradesh have far higher death rates and potential years of life lost, as they all predominantly affect children and young people. I have tried to give an overview in spite of scanned data available on this. Whatever is available, it shows a gloomy picture of neglected public health, local public health problems. And here we are bothered of pandemic treaty. What about our even domestic? Who is looking after these cases? Who is addressing these problems? We are having treaty for imaginary pandemic in future, whereas here we are having 10 times already severe diseases. Why wait for a pandemic? Offering mass vaccination against COVID-19 to populations in such predicament is tantamount to asking them to eat cake when they cannot afford bread. Here we have got our own illnesses, which normal treatment is not available, and we are talking of vaccination for COVID-19, which hardly affects the young children. And that is just like giving them cake when they don't have bread. As Professor Martin Kulldorff, a leading epidemiologist from Harvard University, unfortunately, since I wrote the column, he has been sacked by Harvard University. He is no longer professor at Harvard. Said on the mismanagement during the pandemic. So Martin Kulldorff said on the mismanagement during the pandemic, we have to go back to the basic principles of public health that was thrown out of the window a year ago. It is not one disease. Public health is about all the diseases and all the collateral damage. So here I am just trying to give example of the other diseases which we are neglecting. Collateral harm due to making all resources available for only one disease which is hardly having any impact. Regrettably, following the science was lip service in the pandemic. In an editorial of the British Medical Journal, COVID-19 politicization, corruption, and suppression of science, Abbasi poignantly states the stakes are high for politicians, scientific advisors, and government appointees. Their careers and bank balance may hinge on the decisions that they make, but they have a higher responsibility and duty to the public. Science is public good. When good science is suppressed, people die, as they were dying in our country. So this is all I wanted to bring to the notice, because again preparations are being made for imaginary year. And here as it is, I am also presently one of the sufferer. Large number of my family members are suffering from fever and difficult to diagnose what is the. I was talking today only to a virologist, ki how do I know for Zika, how do I know for dengue and chikungunya, because all are related viruses. And will RT-PCR help in Zika? Or because chikungunya I was suspecting, because I have got all the joints are having severe pain and swelling of all the joints. So I asked him, shall I get RT-PCR? Well, then he confessed that we do RT-PCR within closed doors. Because if we test the same sample 4 times, we get 4 different results. So that is the state of affairs, because the tests are not reliable, they are not easy, but Okay, these are okay for academic purposes, but based on RT-PCR, we had handled the pandemic and had very restrictive measures when the virologist in confidence anonymously is telling me that it's not a very reliable. So that's all I wanted to bring to your notice. Thank you so much.